A lot of congenital defects has been linked to maternal malnutrition, and a lot of women get pregnant without even knowing that they are pregnant until they are about 3 months gone, and most of the vital organs must have developed at this stage. Take for instance, the lungs and the brain develop at 14 weeks of pregnancy, while the lungs develop late 10 weeks later. This simply means that early malnutrition impairs the heart and the brain, while later malnutrition impairs the lungs. And this brings us to today's video, which is on foods to eat prior to pregnancy, or if you're trying to conceive, or if you are a woman. These are the foods that are very, very important that you must eat, the nutrients that you need to eat so that your body gets prepared. You're welcome to my YouTube channel. If you are new to this channel and you're seeing this beautiful face right here for the very first time, I am Maria Celine and you are welcome. I'm a nutritionist, dietitian, and also a lifestyle vlogger living here in Nigeria. Nutrients needed for conception, or that must be present, readily available prior to conception, it's folate. Folate is the natural occurrence, while folic acid is the synthetic type. An average woman or a lady needs about 400 milligrams of folate. So guys, I'll be showing you the synthetic type of folate, that's the folic acid, and you can actually get it from any pharmacy store anywhere you are in Nigeria. So this is how the synthetic type of folate, that's the folic acid, this is how it looks like. Okay, you can get it from any of the pharmacy stores anywhere, even in abroad. So this one is very, very important that you take it as a young lady. You take it one morning, one night. That's with all these some of the foods that are rich in folate. Okay, and the foods that are rich in folate include the oranges that the oranges, the avocado, the spinach, the lentils, from the legumes, of course, the beetroot, etc. And one of the deficiencies of folic acid is neural tube defect, and neural tube defect is split into two. We have the spina bifida and the anencephaly. The spina bifida simply means that the inability of the spine to develop properly during child's formation. Okay, so when this is not well developed, there is usually a bulge at the spinal cord of the baby and it fails to close up. Okay, so while anencephaly simply means the inability of the brain to develop properly, like you will just see the brain will be somehow, it won't develop properly. Okay, so this makes the child to die even before childbirth, or maybe immediately after birth. Most times it causes paralysis also. So it is very important that you get folic acid or folate from your food sources prior to pregnancy. For this will help save you from a lot of these important nutrients prior to conception. Is iron. Iron is a precursor for blood formation, and it also carries oxygen throughout the body. That is the heme iron. It helps in the transportation of oxygen throughout the body. And as a woman, you guys know that we are very, very much prone to anemia. So because of our monthly flow, we lose blood every month. So this alone is one reason we should have enough iron in our body. And there are a lot of foods that are rich in iron. Okay, the foods that are rich in iron includes all the dark green leafy vegetables, our egg, our meat, that is the lean part, the fleshy part of the meat, not the fatty part of the meat. Okay, remember to consume vitamin C while taking iron rich foods, because iron is just like the oga that will do the work, while vitamin C is like the vehicle that conveys the nutrients to where it to do the work. It's just more like helping it to be recognized by the body and for easy absorption. Okay, so it is not just fruits and vegetables that are rich in iron, or the lean meats and other of the nutrients that I mentioned that are rich in iron. Foods that are also rich in iron include our fortified cereals. Like when you're going to buy your cereals, like your Golden Morn, oats, etc., you have to check the label, the back of it, to know if it is being fortified with iron. Okay, so Another important nutrient is calcium. Okay, calcium helps in the formation of the bones and teeth, that is the baby's bones and teeth. And there is insufficient amount of calcium during fetal development, the body goes down to the ones being stored in the bones and takes it up without even your permission. Like it synthesizes this calcium being stored there, making the bones very brittle and prone to, breakage. And this condition is known as osteoporosis. Osteoporosis simply means, osteo simply means bone, while porosis simply means porosity. Okay, the bone is just porous. Okay, so it is very, very important that you have calcium enough, that is sufficient enough for your baby, for yourself as a woman also, and for the one that is sufficient also for baby's formation. And the foods that are rich in calcium are the kale, all the dairy products, that is the milk, almond milk, soybean milk, the sardines, okay, some fortified cereals, they are all rich in calcium. So it is very important you get this calcium. Another food that is very crucial and important to consume prior to pregnancy or conception is omega-3 fatty acids. Omega-3 fatty acids helps in the neurological development of the baby, that is the vision, the brain and the vision, the retina them. Okay, it helps them to develop properly. So, and there are some foods that are very rich in these omega-3 fatty acids, which comprises of all our seafoods, the walnuts, the crabs, the sardines, they are all rich in omega-3 fatty acids. And remember to be careful in the consumption of the fishes, so that you do not consume the ones that are high in foods that are very rich in fiber, foods that are high in fiber. Because if you are trying to get pregnant, you need to concentrate on the foods that are high in fiber. High fiber foods are very important at this time. Okay, and also don't forget to avoid foods that have high glycemic index. High glycemic index foods simply means that foods that whenever you consume them, they tend to shoot up the blood sugar level. And these high glycemic index foods are mostly processed foods, and they make you get fats easily, and they make your blood sugar level shoot up. Okay, so you need to avoid this kind of foods if you're trying to get pregnant, because it predisposes you to gestational diabetes. Gestational diabetes is simply the diabetes that comes that comes when a lady or a woman gets pregnant. Okay, and it tends to go when the person gives birth to her child, but there is every possibility of it coming back again as type 2 diabetes if care is not taken. So it is very important to avoid the foods that are high in glycemic index, especially the processed foods. Okay, those foods that we know that have a little or no nutritional value to our body. Okay, so another thing I would like to share with us is exercise. Okay, regular exercise is very important. If you are a woman or you are a lady and you are preparing yourself for conception, you need to exercise regularly, so that the body do not get to a very high BMI or a lower BMI. Okay, so your body gets to be fair, your health quality. Okay, and its importance can be immediate and also long term. So it is important as a young lady to always exercise regularly. So with this, guys, we've come to the end of this video. I hope you guys like this video. I hope you enjoy watching this video. If you like this video, do not forget to give it a thumbs up, and if you've not subscribed to this channel, don't forget to hit the subscribe button and click on the bell beside it, so as to get a notification each time I post a video. Okay, thank you guys, and God bless you. See you in my next video. Bye.